So if what causes a cavity is bacteria and too much sugar, poor oral hygiene and minerals being sucked out of your tooth, then to reverse a cavity, we need to get rid of bacteria, improve your dental health care, stop eating sugar, reduce carbohydrates and find a way of putting the minerals back in your tooth. And this is exactly what my 10-step formula for reversing a cavity does. So I'm going to share with you this formula right now. Number 1, quit snacking and only eat at meal times. The more often you eat, the more food you provide for the decay producing bacteria. Number 2, brush your teeth and clean your mouth properly to remove food and disrupt the biofilm and plaque formation. This involves brushing, flossing, interdental brushes, even a mouthpick or a water flosser. 3, use a toothpaste that contains hydroxyapatite to help replenish your teeth with minerals. Number 4, use a natural mouthwash to reduce bad bacteria and promote good bacteria and neutralize acids. 5, stop sugar and sweet foods and limit your carbohydrates. Number 6, eat foods rich in minerals and vitamins and follow what I call the dental diet. I'll link to some of those videos for you so you can refer to that. Number 7, supplement with vitamin D3 and K2 to help distribute calcium back into your teeth. Number 8, use xylitol mints or chewing gum after eating or drinking anything that isn't water, and then wait about 30 minutes or more before you have anything else in your mouth. 9, use a dental probiotic to put good bacteria back into your mouth and improve your oral microbiome so you have friendly protective bacteria. Number 10, reduce your stress and get more sleep. As stress and poor sleep weaken your immune system, then make you more acidic and cut your body's ability to heal and repair. I would advise that if you're going to take this approach, you let your dentist know that you'd like to try and remineralize your cavity and ask how long they think you can go before you need a filling. I would normally advise my patients 3 to 6 months, and no more than that if you're applying all the things I've suggested in the 10-step formula. The key is to stop the disease and give the tooth a chance to remineralize. And look, it may be that we do need to do the filling, but at least you've given yourself the best chance, and now you've altered the course and the cause of events so that going forward, this hopefully can be the last filling you ever get. Now here comes the disclaimer and the answer to the question. Can you fix a tooth if it's already got a hole in it? If your tooth is caved in, if it's chipped or broken away, this 10-step formula will not work. You need to have intact enamel. We need the shelves to be still standing if we're going to restock them with minerals. If your tooth has an actual physical hole with enamel missing, it's too late and you will need to get a filling. Once the tooth caves in, you have a cavity and that has to be restored. This doesn't mean you should throw your hands up in the air and just give up and not apply the remineralisation program I've shared with you, as this will slow down the decay and prevent more problems going forward with your other teeth. So please don't think that you can fix a hole like this without dental care. But you can fix and reverse areas of decay, caries, even in some cases if they go into the dentine, so long as you don't have sensitivity and toothache. The dentine can reharden because the tooth is porous and the minerals can get inside, and so can the mouthwashes and the xylitol and the good bacteria from the probiotics. You can't do that with flossing or something like oil pulling. Flossing does not fix decay. It just removes food and bacteria from between your teeth, and that's why I do like you to floss. So what's next? You apply the 10-step formula. You give 3 months or up to 6 months if your dentist and your tooth say it can wait that long. Remember, if you've got toothache or your tooth caves in and gets a hole, it's too late, you need a filling. After your 3 to 6 months, you need to go back to the dentist and you must be prepared to have another x-ray. because what we're looking for is signs that the enamel is filling in and that dark area, the hole, is not as dark or as big as it was. Ask your dentist to show you the x-rays so you can see any changes for yourself and note if the enamel is healing or not, which if you've put the right work in and made the changes, it should have. Remember, demineralized, sucked out mineral areas look black, and when they start to remineralize, you will see that they will become lighter grey or white again, and this means your tooth is repaired and you've reversed the tooth decay. Make sure you watch this video here, as I know you're going to want to watch to know how to eat and prevent and heal tooth decay and really put the 10-step formula to reverse cavities into practice.